Dr. Hill is your prototypical stroke neurologist. He is super gung-ho, racing to the emergency room to save brain, essentially. We're basically brain plumbers. We have to act fast to deal with the plumbing system of the brain. The brain's dying every minute. In fact, you lose 1.9 million neurons per minute with a stroke.
His work has directly influenced how stroke is being treated worldwide, and he continues to do that. It has impacted not just the field of stroke research, but it has impacted hundreds and thousands of patients who are now having improved outcomes because of good stroke research and care.
The problem of stroke is that you become neurologically disabled or incapacitated, and so care was all around providing that capacity, helping people eat and learning how to walk again and things like that. So it was all supportive and directed at rehab. So if you survived, you made it to the possibility of rehab. There was no acute treatment.
What was incredible about Michael is that he really kind of saw in parallel the way that the system would need to accommodate, and the people working within the system would really need to believe in the treatment. There was a really great energy he built up between collaborators with his team during the ESCAPE trial, which was the kind of practice-changing thrombectomy trial. People really got excited about the benefit. People were cheering each other on for recruitments during the study.
When you see Michael care for a patient, it's eye-opening because I've seen him go to the bedside, sit by the patient. You don't really see any kind of hierarchy between the doctor-patient relationship. Be straight with them. Hey, buddy, you had a stroke. This is what we're going to do to make sure that you don't have another one.
Michael is an epidemiologist, so he's made some very intriguing observations on the epidemiological side. One that really comes to mind for me is the influenza virus and influenza vaccine data that he's been part of in terms of, and that's epidemiologically driven from Alberta, where he's been able to show that if you take the flu vaccine for 10 consecutive years, your risk of stroke is reduced in half.
One of the principles of epidemiology is that if you have consistency of effect, and it's not just broadly true, right? If something is true in multiple scenarios, it's probably true, right? And so that was a really, that was fabulous as well. And then those ESCAPE trial and others contributed to this change where now this therapy is everywhere, all over the world.
When I was getting my own clinical trial together, you're trying to apply for all these grants and talk to all of these people. Mike said to me, he's like, T, just start. That's really how he has inspired teams to achieve things in the incredibly quick timeline that is hard to fathom within the slow-moving systems where we tend to dwell.
Dr. Hill's legacy will be in setting a gold standard for performing stroke clinical trials and to have mentored a large cadre of young stroke clinical trialists who will then take this and continue to take the field forward for generations to come.
Visionary stroke neurologist whose landmark clinical trials revolutionized the treatment of acute ischemic stroke and established new standards of care worldwide. Canadian Medical Hall of Fame laureate, Dr. Michael Hill.